Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is a longtime person that I've known on Twitter for a long time, but finally see in person, even though we're virtual. Anyway, our guest is Lucia Savage. She's chair of the Academy Health Committee on Advocacy and Public Policy. And for her day job, she's the chief privacy and regulatory officer at Omada Health. Welcome, Lucia.
Thank you for having me, John. I'm so excited to be here.
I'm just excited that you're real because we've tweeted together for so long that it's kind of fun to actually be here.
Twitter is definitely the place where there's some really rich health IT policy community having a very respectful dialogue with each other. So
Yeah.
bring it on.
I know, and that's what people don't understand is that interaction that happens. There is this other side of Twitter that we won't discuss today, but anyway, but we don't need to talk
Right.
social media here.
Exactly. I don't know.
Yeah,
Might come up. You never know.
Yeah, it may. Well, let's dive in here. For those that don't know you, that haven't followed you on Twitter yet and should, but tell us a little bit about yourself and also your work with Academy Health and also the Health Datapalooza conference.
Sure. Well, just a little bit of background about myself. I've been practicing law a very long time. In fact, when I started practicing law, there were no smartphones, there were no computers, and there was no HIPAA. It actually wasn't even a statute yet. And so
Wow.
I really cut my milk teeth on that law as it developed and as the science and structure in which digital health is maturing became a thing. And
Mhm.
so that is, once I sort of saw the power of what you could do with the data, and this was early days, just like measuring HEDIS breast cancer screening rates from claims data, like early days,
Yep.
I was really taken with the ability of this data processing and science to really help us understand what works and what doesn't work, to like find a bad pattern and break it, or to find a good pattern and amplify it. But of course, you have to do that while you're respecting the personal dignitary interests of the people from whom we get that data. So privacy is kind of grounded in this idea of dignitary interests. And so that's really where I've taken my career very intentionally into how do we learn more now that we have more data and the data is richer, but how do we do that in a way that people can trust the processes, people aren't going to be harmed by the information, et cetera.
Yeah, absolutely. And how about Health Datapalooza? Talk about your work there and the evolution of that conference.
Sure. I wasn't around in the early days. The earliest days of Health Datapalooza were like a little brain trust confab between members of the National Health Service and members of the first term of Obama administration health officials. If you want the true history, you've got to go back to like the Todd Parks and Anish Chopras of
Yep.
the world.
Uh-huh.
But it really grew into a place that, because it's centered in Washington and because it's not glitzy, it's really a place for accessible dialogue. It's one of those places where ordinary people and patients, we have a long history of patient scholarships, can come and interact with people who are listening so that they can make policy or explaining policies that they've made. I'll never forget last year, which was our first year live after COVID, we had the administrator of the EPA come
Uh-huh.
and do a plenary. And it was so fascinating, the conversation about health data, healthcare, and environmental change, that even the photographer put his camera down and listened. Amazing. And you won't find that at any other conference. There's the showroom floor is different. It's just different. And it's also quirky and kind of fun because of it has this background in, a bunch of wonky people trying to share ideas.
Yeah. So, I mean, I think that's the interesting part. There's so many data conferences out there and health IT conferences out there. We list them at Healthcare IT Today, and
Right.
they just seem to keep popping up more and more, which is, I'm not sure how that, is sustainable, but talk more about what can someone expect at the Health, Datapalooza conference. Is it access to government officials? Is it access to data resources? Is it education? It's interesting, the patient angle you talked about.
Yeah.
What would a patient expect if they went there? Talk about some of those things.
Sure.
What are the sessions, exhibits, sponsors, et cetera? Talk about how do those all come together at the event.
So a really important feature about it is it's always been sponsored by a government, or in the case of Academy Health, by a nonprofit under a government contract. And that gives it a really different flavor because it's not about selling stuff.
Mm-hmm.
It's actually about the dialogue. It's actually about the learning. So that's one thing that's pretty different about it. The second thing that's pretty different about it is because of that platform, what you get, the dialogue can be really rich. And in fact, there can be a lot of critical dialogue, meaning people are being critical of what each other are saying in a polite and respectful way. That's really different than a dialogue you might find at a conference that's built more around sponsors trying to sell things and less about fostering the dialogue. So that's one thing that you'll find really differently. Secondly, I think you'll find that it's trying to bring practical and measurable things to the policy realm. So for example, I know there was some criticism. I was following the trades after the JP Morgan conference, which just finished, in San Francisco a couple weeks ago. And there was definitely some industry observers talking about, it can be a little bit of a fishbowl, right? Everyone talking to each other and being really enthusiastic. But I think at Health Datapalooza, you're really going to hear people saying, wait a second, is that really true? Did you think about this thing that you haven't thought about before?
Yeah, that's interesting. Yeah, I remember when I went one year that it was, just as we were getting access to all the, Medicare data and different, unleashing that. And how do you do that? And how do you request it? And, like you said, it is very niche topics that, quite frankly, are quite nerdy, health ID nerd, your data topics, but it's powerful.
It can be. I think, as a person who's working on the group of people trying to guide this year's Palooza, I think there are going to be some topics there that are not niche at all. Okay. For example, equity is really taking a place that's front and center. And that's something that affects most of Americans, not most of white Americans, but most of Americans. And we'll be talking about it in a few different contexts. I'll be doing a panel on, patient activation, which really depends on patients being able to use apps and smartphones and broadband and a bunch of technology things, and equity. Right? When we think about patient activation, are we thinking about all people and the access they do or don't have to these tools? Are we thinking about texting versus broadband enabled app-based communications? Like, are we thinking about all of it? Or is the idea that a patient can, be activated and basically disagree with their doctor or have a detailed conversation with their doctor, is that something that we white people are wrongfully thinking applies to everyone? Like, I don't know. I'm curious about that. And so I asked them to organize this panel.
That's awesome. Yeah, but you highlighted the connection between the event and the conference and kind of the federal policy, the regulatory side of things. As you look at, as we head into this conference, what do you think are going to be maybe the biggest issues to kind of follow this year at the conference? What are going to be those hot topics, hot regulatory policy topics?
Well, I know, the FDA administrator, Dr. Califf, is going to be a keynote speaker. Mickey Tripathi is going to be a keynote speaker. And so they will, of course, be talking about Food and Drug Administration and digital health. And then Mickey, of course, will be talking about information blocking, interoperability, potentially social determinants of health. So they will bring their portfolios with them, but they'll be bringing them to a crowd that, again, is a bunch of very astute observers. And so I would be watching the Q&A after those keynote addresses. Then I think there's some things that are sort of coming down the pike, or that we'll have to see more of. There's going to be a session about digital health post-Dobbs. This has been something that a lot of people have been interested in, whether it's privacy and fertility tracking apps, or electronic health records and law enforcement access to them. Those are topics that certainly I have, as a privacy expert, have talked about. My good friend Devin McGraw will be moderating that panel. And then I think Datapalooza is often a place where, if you pay attention to the breakout sessions, you will see what's going to be a big issue coming in the future.
Yeah, that's interesting. Yeah, I mean, given your background, what are some of the things you see that are really moving at the federal level related to health IT, and maybe what isn't moving? Like, that you're like, oh, I thought this would move, or, should move. And maybe, what are some that you think should be moving?
I think some that I think most people who are sort of working on this on the ground every day are wishing for clearer rules, or the proposed rules to come out about what the information blocking penalties will be. These are quite overdue. As a person who's advising a company and knowing what other people are trying to advise, it's really hard to plan when you don't know how much trouble you'll get into. You just know that trouble is kind of there in the background. And we don't want penalties to be forestalled, because we don't want all the people who could facilitate interoperability and avoid information blocking to not do so because they don't think the penalties are real, right? That we don't want to feel like the government's crying wolf. On the other hand, we also don't want the penalties to be so high that people just put their heads in the sand or take other adverse action. So we're all waiting for that to come out, both from CMS and the Office of the Inspector General. The other thing I think that could be more accelerated is in this app-enabled ecosystem that is being unleashed because of the FHIR standards and the way ONC is articulating the data standards under FHIR. I think there could be a lot more rapid cycle, to use the Silicon Valley term, agile education about handling that and what that means. There's been an incredible and vocal dialogue about the privacy of apps, but you don't see any federal guidance about how do you recognize a good privacy acting app and a bad privacy acting app. How do you recognize an app that is high caliber wellness advice, or even like Omada is being used actually as a communication tool between you and a healthcare professional? Apps have different purposes, right? Versus something that's kind of crummy or not particularly beneficial. So it's and that guidance could help researchers. Researchers don't understand when they look at app stores, and certainly consumers don't understand. And so I would love to see more agile guidance. When I was at ONC and my friend Devin was at OCR, we managed to push out a lot of educational material in pretty rapid cycles. So I actually know it can be done. And I would really like to see more kind of dialogue, even a way for you to submit a question and have them give you an answer like within 2 minutes, right? So that would be really great. But in terms of things that kind of are happening, I'm very interested in some of the things the FTC is doing. They have a brand new booklet out about assertions about health that commercial organizations make to consumers. It just came out last week.
Interesting.
It includes digital health apps and what they assert about their health, the caliber of the health information that they're providing.
The snake oil stuff, right? Trying to avoid that.
Exactly. I haven't had a chance to dig in yet, but I did notice it came out last week, and the FTC just updated. They have done a tool with OCR and the FDA many years ago during my tenure, but they've updated it. It's a tool about, where a developer can, on a Q&A basis, kind of figure out what regulatory buckets they need to comply with. So the mHealth digital app developer tool is out. So there are things happening, but I work in a very small niche of healthcare, and as many advocates in any domain of healthcare, you want more to help you do your everyday job.
That's such a good point. And the one that I would highlight for me is that, some sort of overarching consumer privacy law. It feels like it's been bubbling for a few years, and I don't think it will happen by the time Datapalooza rolls around. But, we've had HIPAA for a while, as you mentioned, but I feel like there's some consumer privacy overarching one that's going to come in, and then we're going to be like, wait, so how do we navigate both of these? Because patients are often consumers, and it'll apply to them. So that's the one I'm watching for.
I think that's exactly right. But again, you have to think about different agencies' authorities. So FDA doesn't have authority over privacy. ONC cannot create a consumer privacy law, nor can OCR at HHS. You really have to look to Federal Trade Commission and to states. And if you are personally interested in that, the International Association of Privacy Professionals does their annual conference every April in DC. And I'm sure that the FTC will be in full force talking about consumer level privacy and what can be done regulatorily versus requiring statutory activity and more grants of authority from Congress. It's a very complicated legal problem to solve. And I know it will be talked about at Health Datapalooza, but it also is going to take effect in other domains.
Yeah. Well, you've mentioned a bunch of things at the conference, but is there something you're like most looking forward to? Is there a talk? Is it just talking with the people? Like what's the top of your list for what you're looking forward to at the conference?
I'm definitely looking forward to the session on Dobbs because I think there's a lot of opportunity for that to be a place for people to learn.
Mm,
One of the things that is a fundamental principle of privacy, which is information should be private when its release would harm the patient,
mm.
right? And that the reproductive health information is the quintessential test case for that.
Yeah, we
Um,
see that in the information blocking, what the 8 exceptions, a bunch of them are related to that.
And those and yes, and remember, one of those exceptions is if there's an existing state law, and there are many state laws that specially regulate reproductive health information, particularly for minors. And so there's a very complicated policy fabric there, but also it's going to be an interesting discussion about what happens next. And I think that will be the focus of it. There's also going to be a keynote about medical misinformation, which I
Oh,
think
interesting.
also, medical misinformation, obviously we see it on social media and other things, but also think about how that intersects with what the FTC is probably saying in its guidance, right? Like, don't make up your science. That would be kind of fundamental, right? Don't mislead people about what the science is behind the thing that you're doing. And let's not exacerbate an existing problem with medical misinformation. So I'm kind of looking forward to that too. And it's fun. You see people, Fred Trotter is going to be in shorts and Birkenstocks for sure.
and a suit coat.
Not a plug for Fred, but you see him in that. Yeah. So it'll be fun, even though it'll be February and I'm sure it'll be like cold and gray outside in DC. We'll be having fun indoors.
Yeah, that's really interesting. No, I mean, I think that's part of the fun of a conference is you don't know what to expect. You don't know the conversation you're going to have. But there are so many important topics to be discussing. Where can people go to learn more about Health Datapalooza if they're not familiar with it?
Just Google Health Datapalooza. It'll pop right up on your search bar. It has I'm going to misquote the hashtag, so I'm going to count on you to put the right hashtag up. I think it's hashtag HDPalooza.
You're right, I think.
Yeah. You can go to Academy Health's website and look at events, and you'll see the agenda there, and you can look at the things you want. And I definitely encourage people to look at it, especially if you're can get there without travel, day trip it or whatever. There's a lot of opportunities. There are patient scholarships available. I don't know what the deadline is for those, but people can definitely apply to get a subsidized registration. And I'm a big Datapalooza fan because it's fun. It's just fun. And the conversation is interesting. I won't say it's not so sophisticated you can't figure it out.
Mm-hmm.
It's not that wonky because it's very practical, but it also is conversation about things that are going to be very meaningful in your life.
Yeah, I'd say it's one of the most practical conferences I see where you're talking about practical problems with the data that's available from the government, from other sources, and how are we using that data. So, Lucia, I'm so glad you joined us to share about this perspectives and kind of what's happening with all the policy and data. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Lucia.
You're welcome. Thanks for having me.